internationally working media agency. Somewhere here. When the technique works, you will see now, we started this project 2005, and the first spot we produced was this one. So the voice would say, do you like children in ways you shouldn't? And then the next sentence would be, don't become an offender, there's help. This was the message. And in my eyes it was really brilliant done by it was an actor, professional actor. And it was shown in every television channel of Germany, and this is the outcome. You can see here, after the launching of the project, July 2005 until September 2016, we have in Berlin more than 2,000 contacts. Did approximately 1,000 assessments, and offered 500 persons treatment. This means without any costs for you and with strict confidentiality. So they can come to us anonymously. And this is really necessary because they are coming from all social levels. You see, this is the average age. 55% have higher education, so we have physicians, we have lawyers, we have priests, we have teachers, we have unskilled workers, we have all kinds of nearly only males. And you can see 40% are currently in a partnership, and you remember maybe the non-exclusive type of pedophilia, which means that they are oriented towards adults as well. So they will try to realize a partnership, and 35% are a reference person for children. So this is, none of them is known to the legal authorities. This is a Dunkelfeld. This is very sad, really very sad, because we have to face the fact that those men who are really open to us admitted in 42% that they already use child abuse images. 40%. 39% abuse children, and 30% did both. Child sexual abuse and the use of child abuse images. Dunkelfeld, not known to the legal authorities. This is a really amazing fact. Only 12% did nothing. So these are the really potential offenders, and these are those ones who already offended, and these would be persons you need to report by your law, your mandatory report law. So this is a really important difference. We have to discuss this aspect later on. Now this disturbs me a lot, because you can see all these pictures in the internet, erotic posing, explicit erotic posing, and you clearly can see that these children are trained to do this. They are trained to be sexually in sexually interactions, with other children or with adults, and you can see, unfortunately, the whole spectrum of paraphilia associated behaviors. It's really a mess. And the law enforcement system in Germany would say, we are not able to handle this. It's growing and growing. So in the assessment, for us, the fantasy level is the most decisive level, and we would not condemn a person concerning to these fantasies. They are not harmful to others. And it is important to communicate that we would not judge the sexual preference itself. We would only judge the behavior. And this is the outcome. You can see that we can describe the different subtypes according to the fantasies of the participants of our study. And approximately 20% would have an exclusive type of pedophilia, 10% an exclusive type of hebephilia, all the others are mixed types. And now, back to the attachment dimension. What I told you first, that we are all look out for persons we can trust, we can feel accepted and appreciated, and in persons with sexual preference disorders, they worry about the lack of acceptance and the lack of fulfillment of psychosocial needs. The fear not to be lovable anymore if the other one would know about the preference. I will refer to this point later because I will tell you something about our new project addressing juveniles. This is for adults, so you can enter this study only up, from the age 18. And we could show that our approach with a combination of cognitive behavioral, sexological and pharmacological options work. We can't change the pedophilia, but we can help the person to control the impulses. And the goal is the complete abstinence. That's what we're trying to achieve. So again, we can focus on the impulses, not on the fantasies, but here's the behavior level. And we are doing this by reduction of risk factors, for example, low victim empathy or cognitive distortions. And we are including significant others in the treatment, and we are using pharmaceutical options. But again, we are not trying to change the quality of sexual fantasies because this is not possible. But we can change the urge with treatment. And there are different types of substances. We are using antidepressiva, serotonin reuptake inhibitors. We are using opiate antagonists and androgen deprivation therapy. It's just to inform you that this is one part of the treatment program, and everybody knows in our program that this is an option for him. And if he is really problems by controlling the behavior, he will show up and tell us he needs this medication. So the evaluation of the treatment program reveals that we can reduce the risk factors, we can prevent sexual offending against minors, and we can at least reduce the frequency and the intensity, the severity of consumption. It is so easy to get access to these materials. There is practically no deterrence, because very rare that the law enforcement could find the guys. So this is the development in Germany, because we have participants from all over the country. We launched now 10 more branches in all over Germany. And these are the data from the whole network. We call this network Don't Offend. And you see in all 11 branches we have more than 7,000 contacts, more than 2,000 assessments, and more than 1,000 treatment offers. So this is the reason, this is really a milestone in Germany and in the world, I guess. This is the reason why the German parliament voted for legislation to finance these specialized treatment for self-referred pedophilically inclined individuals through the health care system. And this will be done anonymously. You can get this help anonymously, and it will be paid by the insurance system. So, because we know that the sexual preference manifests during puberty and remains stable from this point, we focused on the juveniles. In the year 2014, we've got funds by our Federal Ministry for Family Affairs, and we are working together with Clinic of Child and Adolescent Psychiatry in Berlin. And this is really necessary. I will show you in a minute why. First, these are self-reports of adults from our project, from the other project, from the first project. And they would say, my interest in children started on the fantasy level during puberty. They would say, this was soon accompanied by attempts of sexual contacts with children from the family or the neighborhood. And it was much easier to do this because the age difference was less, to the age difference to the victims. And it was never sanctioned. So it all happened in the Dunkelfeld. And we know from our German criminal statistics that 25% of the reported cases of child sexual abuse concern individuals below the age of 18. So these are the offenders. 25% of the offenders are below the age of 18. Goal has been prevention of the behavior disorders. To prove that we can reach out for these groups and reach them with primary prevention measures. And that we can assess juveniles according to their fantasies. And I can see here this is really possible, and this is a really very important work with juveniles. These are the age-adapted flyers and advertisements for juveniles. We run this via social media, via Facebook, Instagram. Just streaming of them is the website. And we used Google AdWords. So if anybody would enter this keyword, then he would be guided to our website. And this is the age group. between 12 and 18. Voluntary consent and agreement, no ongoing legal procedure, and sexually conspicuous behavior and or fantasies indicating a preference in terms of interest for prepubescent body schemes. So what was the outcome? "134 interested adolescents contacted us. Between 15 and 16 was the age. All of them males. Only one female contacted us via email and didn't show up. 20% of the juveniles contacted the project by themselves. The others were introduced by parents, guardians, or clinical professionals. So now one case example, very remarkable 14 years old boy, very intelligent, and there was a legal investigation against the father because of the use of child abuse images, but then the son confessed that he was the one who used the computer from the father. No lawsuit because he was 13 years at this time. Orderly family circumstances, no additional psychiatric features, and he would say, since start of masturbation I fantasized only about girls at prepubescent with a prepubescent body scheme. And then he would say, I know exactly what's going on in the internet, I know all these pictures, I know there's pornography concerning adults, but it's not of any interest for me. I'm only interested in prepubescent girls. So clear and exact and specific, it's remarkable, and he's very, very thankful for guidance to cope with his fantasies, and we must say that it's really good work with this group, and it's very successful. So we can stop them completely from acting out at the moment they enter treatment. But this is very sad to say that 80% of the juveniles already had sexually offended. Of the juveniles. 20% used child abuse images, 40% abused children directly, and 20% did both. So this is reality. We have to face the fact, I mean, at least it's reality in Germany, I have to add. Nearly 90% have siblings. These comorbidities are most hyperkinetic disorders or attention deficit disorders with problems in impulse control in general. And we are very happy to say that nobody of the juveniles treated by us did not stop his acting out behavior. We can clearly say that 45% are exclusively attracted towards children, 35% non-exclusively attracted, and 20% attracted towards adults. These are the surrogate type offenders. So juveniles can use children as substitute for the relationship to adult partners. These are not, they are not attracted towards children. And what we are doing is to help the juvenile to integrate the preference particularities, to become an expert on oneself. We train behavior, and we are working with close persons, increasing family functionality. And can clearly say that this work prevents sexual offending against minors and the consumption of child abuse images. Every involved adolescent refrained, and the patients are very grateful for guidance and willing to accept advice. If they feel not to be condemned because of their fantasies, and you know now that they didn't choose the fantasies. As I always said, pedophilia is reality, and pedophilia is at first a diagnosis and not a crime. So what we can do is, and these are chances for child protection, we can raise problem awareness, we can spread knowledge concerning this primary prevention approach, we can encourage diagnostic offers, and it's needed not to combine this with judgment, and we need to put the attachment dimension of sexuality into account. Everybody needs a person who will accept him. This is why we are working with the social surroundings. And because we have access to this group of potential offenders and self-referred pedophiles who would not fake their fantasies, who would tell us the truth, we can run new kind of studies. So what we now can say is that there's a possibility of assessment of pedophilia via neuroimaging measurements. Very high classification accuracy. So my last messages are, I'm really very motivated to run primary prevention approaches internationally, because child pornography is a topic of international concern because of the World Wide Web. And of course those one who uses child pornography are pedophilically inclined persons. Believe me, this is an indicator, and it's very logical. We have to face this huge Dunkelfeld, and pedophilia is a part of human sexuality. And I would assume that is to be found in every country, in every culture. It's not only a German phenomenon. I don't think so. So this is a calculation I've done. You are familiar with this number, 1% of the male population in Germany according to population-based studies, which count to 250,000 in absolute numbers, and we have contact to 7,000. This is only 3% of 250,000. So, but if you look at the numbers for India, then you would get 3.5 million pedophilically inclined individuals. And if you run such a prevention approach, you would have contact to 105,000. But you have this mandatory report law, so you can focus only on the potential offenders, the real potential offenders, and they account for 10%, so that would be 10,000 who would come if you offer them treatment, 10,000 in India. This would be the calculation. We have we have no mandatory child abuse reporting law. This is an advantage, huge advantage. Therapist-client confidentiality is guaranteed in Germany. So, good evening, everybody. Good evening. Thank you so much for this warm welcome. Respected dignities, ladies and gentlemen. I'm really deeply grateful to be here, and I would like to share my clinical experiences and research results done at the Institute of Sexology, which is part of the University Clinic of Berlin. Can you hear me? Okay. And the clinic is called Charité. It is supposed to be the biggest university clinic in Europe. And this is the building I'm working in. I'm working in the same office as Robert Koch did, who once discovered the infectious agent of tuberculosis. This was in the year 1882. So there is a huge medical history in Berlin, and this is true for sexology as well, because this discipline was founded once in Berlin 110 years ago. And I'm working there as a physician since 20 years now in this institute, and since 30 years in the field of sexology. And in the outpatient, oh, this is not the right, excuse me, I have to start again here. So in the outpatient clinic of the institute, we are dealing with the whole spectrum of sexual disorders. As you can see here, disorders of sexual function, which are very common, and it's a long-term consequence for victims. I will refer to this later on. Disorders of sexual development, and then the gender dysphoria is a huge area. Disorders of sexual reproduction, but for today, for the evening, I will refer to those both. Disorders of sexual preference, another term would be paraphilias, and disorders of sexual behavior. And you will see that we can differentiate those disorders very well. So there is one basic concept of sexuality which appears to all these disorders, and it's very important to understand this concept. And you will see it's important for our understanding of sexual preference disorders as well. And this concept means that there are 3 core dimensions within sexuality.